might just think about a really bad headache, but did you know migraines are the third most common illness in the world? In fact, for the 38 million men, women, and children they affect in the United States, migraines leave them unable to work or even function. That's why Dr. KJ Uman is here today to help us better understand this illness. Thanks so much for joining us.
Well, thank you for inviting me.
First of all, the very simple question, what's the difference between a migraine and a headache?
Well, migraine is a very different form of headache than the ordinary headache. Migraine is very severe in nature, usually associated with nausea and sometimes vomiting. Light and sound sensitivity is also a part of migraine. People may also have other symptoms such as osmophobia or intolerance of smell. So those things make migraine different from the ordinary headache.
How do you know if you might have a migraine or when you might need to see your doctor and say, I'm having horrible headaches that could be migraines?
Thankfully, many of the migraine headaches are relatively infrequent. However, when migraine headaches become frequent, such as once a month or once or twice a month, perhaps even once a week, that is when most people go to the doctor. Otherwise, once in 6 months headache, they take a Tylenol or ibuprofen or something, or even make a trip to the emergency room, that's the end of that. But when it becomes chronic, it's a different condition altogether.
How are you tested? How do you know it's a migraine?
Well, there is no test for migraine. Migraine is a disease that is diagnosed by the doctor by the history and the symptoms and the signs the patient may have. When I say signs, most migraines may not have any signs associated with it, but sometimes migraine can be associated with physical findings such as drooping in the eye, the pupils getting smaller, or face drooping.
Oh, wow.
Sometimes even numbness and paralysis of one side of the body. The classic example of the dramatic case of migraine attack was that of Serene Branson of CBS in 2011 when she was reporting on the Grammy.
Yeah, absolutely.
Suddenly she became aphasic, was talking gibberish. That kind of things can happen with migraine. Those are called complicated migraines as opposed to the simple or classic migraine.
So what do you do if you have a migraine? What do you take?
Well, migraine, first of all, before we call a headache a migraine, you got to make sure there's nothing else going on, like a brain tumor or sinus infection or something else in the brain itself, a space-occupying lesion. Once that is excluded, then the signs and symptoms of migraine help the doctor make the diagnosis.
Wonderful. So when you have a bad migraine and it becomes something that's chronic, talk to your doctor.
Yes.
Great. Thank you so much for joining us today.
You're very welcome.
Thank you so much for this information. Stay with us. We'll be right back.